Welcome back. Coronary heart disease is one of the most common killers here in the United States, but you can help prevent it by finding risk factors. Here to talk with us today, Dr. Travis Snyder with Simon Med. Let's bring it out to people. What exactly is coronary heart disease?
So coronary heart disease is when the arteries of the heart develop plaque or atherosclerotic plaque. And you have the right coronary artery, which comes down the right side of the heart, and the left comes down the left, and then there's an artery in the back called the circumflex, which goes kind of around the back of the heart. And what happens is those fill up with calcified plaque or non-calcified plaque. And unfortunately, those result sometimes in coronary events, heart attacks. And heart attacks is one of the leading causes of death in the United States.
Doctor, what are some of the things that people can do? Let's say that they're at home right now and aren't really sure of where they're at. Are there things that you should be doing at certain ages, every few years, to make sure that when it comes to that heart health, you're on top of it?
Yes, well, of course, diet and exercise and lifestyle choices are quite helpful. But a scan that we offer is a calcium scoring scan at Simon Med here in town. We have 8 centers, and we offer a scan that scans through the heart using a CT machine. And the CT goes from the top to the bottom, and it identifies these calcified plaques in the arteries. And if you have a lot of calcium in those arteries, then you're at high risk for coronary disease. So it's quite helpful for patients to get that assessment for risk factors for coronary disease.
What are I know that there's probably some age ranges associated with this specific kind of, you want to take care of it. What are there any sort of age ranges? I know we're focusing on men this morning as well.
Yes, well, in older people obviously have the worst risk, but and African Americans have higher risk, smokers, of course. So all those things make it helpful, and we can tell by this CT scan through the heart. We can look and see how much calcium is there, and if there's a lot of calcium there, occasionally those patients will need to undergo a procedure with a cardiologist, so they can see a cardiologist, and they can tell you your risk factors for having. So it's quite a helpful scan.
If you don't take care of this and things continue to escalate with that plaque in those valves, what would happen?
Well, people that have high calcium scores, so when we do these scans, it's not uncommon. We see people that have very intense burden, atherosclerotic burden. And in those patients, they have a high risk for heart attack, and it's important for them to know, to change their lifestyle, to change their diet, and perhaps to see a cardiologist.
My goodness. Well, Dr. Travis Snyder with Simon Med, thank you so much. We'll get everybody connected on our website, news3lv.com, taking care of people right here at home in our community. Thank you so much.
Oh,
we appreciate it.
Appreciate it.